Discharge diagnosis: non-ST elevation myocardial infarction. Number 2, moderate coronary artery disease. 3, stroke. 4, high blood pressure. 5, an abnormally high concentration of lipids in the blood. 6, chronic obstructive pulmonary disease. 7, chronic systolic congestive heart failure. Procedures: left heart catheterization, medical imaging test to determine cardiac function in the left ventricle. Medical imaging used to visualize coronary arteries with stent placement, computed tomography scan, magnetic resonance imaging scan, posterior artery in the brain repair with stent placement. Brief history. This 72-year-old male presented to the emergency room with chest pain, shortness of breath, and left arm numbness. Patient has a history of high blood pressure and an abnormally high concentration of lipids in the blood, chronic obstructive pulmonary disease, and congestive heart failure. In the emergency room, troponin levels and EKG results came back positive for non-ST elevation myocardial infarction. Patient was taken directly to the cardiac catheterization lab. Past medical history: high blood pressure, an abnormally high concentration of lipids in the blood, chronic obstructive pulmonary disease, and congestive heart failure, asthma as a child, and previous right total knee replacement. Medications: Norvasc, Lipitor, Lasix, Cozar, and oxygen dependent. Family history: patient is adopted and does not know family history. All children are healthy. Social history: former smoker, no alcohol or illegal drugs. Allergies: penicillin and sulfa. Physical exam: general, alert and oriented ×3, head, eyes, ears, nose, and throat, normal cephalic and atraumatic blindness over half of the vision field. Lungs: few rales and lower lobes. Heart: regular rate and rhythm without murmur. Abdomen: soft, non-tender, without swelling or masses. And extremities: +2 edema in the lower extremities, no cyanosis. Hospital course: this is a 72-year-old male who was taken directly to the cardiac catheterization lab for the emergency department due to an evolving non-ST elevation myocardial infarction. A 98% close to the right center coronary artery lesion was treated with a Cypher 3.5 by 13 mm stent. The left descending artery showed a 35% stenosis, and the left circumflex artery showed 25% stenosis. The imaging of the left ventricle demonstrated an ejection fraction of 40%. Following the procedure, the patient was admitted to the telemetry unit for observation. He remains in stable condition without chest pain, but developed an irregular rapid heartbeat. The next day, the patient complained of a severe headache in the back of his head with double vision and only being able to see from half of his eye. The patient was taken for a computed tomography scan and magnetic resonance imaging scan, which showed a blood clot blocking the posterior artery in the brain. The patient was taken back to the catheterization room, where a catheterization of the head artery was performed to remove the blood clot and to place a stent to keep the vessel open. The patient is being discharged home on routine meds to follow up with primary care physician within 7 days.